Hot artery balloon angioplasty. The procedure is similar to coronary angiography. When it is found that a patient has moderate coronary artery constriction, doctors will recommend balloon angioplasty or stent placement. This can be done immediately after coronary angiography is completed, or it can be scheduled for a later date. Severe chest tightness, feeling like something heavy is pressing down, shortness of breath, profuse sweating, weakness, heart palpitations, dizziness, nearly fainting. There may be radiating pain or numbness to the arms, shoulders, jaws. Have a history of coronary artery disease, such as diabetes, high blood pressure, and high cholesterol. Have a family history of coronary artery disease, obesity, smoking, lack of exercise, previous detection of abnormalities from other screening tests, such as abnormal electrocardiogram, echocardiogram, cardiac stress test, abnormal coronary artery images. Procedure for balloon angioplasty. 1. The doctor inserts a balloon catheter through the blood vessel to the narrow location in the coronary artery. 2. The balloon is inflated, pressing against the vessel wall and plaque. 3. The balloon is deflated, and the catheter is removed, improving blood flow to the heart muscle by widening the vessel. Coronary stenting. A stent, a small metal tube, is placed on the balloon catheter. The doctor inserts the stent catheter into the narrow artery and inflates the balloon. As the balloon inflates, the stent expands and presses against the vessel wall. After the balloon is deflated and removed, the stent remains, keeping the artery open and improving blood flow. For arteries heavily blocked with fats and calcium or very rigid constrictions, doctors may consider using a high-frequency rotational atherectomy device or rotoblator, which can be done immediately after coronary angiography or scheduled for later. The rotoblator has a diamond-embedded tip spinning at speeds between 140,000 to 200,000 revolutions per minute, breaking up blockages into tiny particles small enough to be safely carried away by the bloodstream and eliminated from the body. 1. The doctor inserts a catheter with a high-frequency rotational tip into the narrow coronary artery. 2. The high-frequency tip abrades the calcium inside the coronary artery. 3. The doctor removes the high-frequency tip, and the calcium is broken down into tiny particles, circulating through the bloodstream, allowing the artery to widen and improve blood flow. Coronary stenting via wrist access. The wrist area is bandaged to stop blood flow, similar to coronary angiography. Coronary stenting via groin access. The doctor leaves the catheter in place until the blood-thinning medication wears off before removing it. The groin area is pressed to stop bleeding for about 15 to 30 minutes. Once the bleeding stops, the area is sealed with an adhesive plaster, and initially, to prevent further bleeding, the groin area is compressed and restricted with a sandbag weighing between half a kilogram and 1 kilogram. Bending, sitting, or standing without a doctor's permission is prohibited. After coronary angiography, patients can eat and drink. Post-angioplasty precautions. Patients should inform the nurse if they feel warmth, leakage, or sharp pain at the catheter insertion site, or if there is a developing bruise, swelling, or it gets significantly larger. Feeling unwell or needing assistance for anything. After the angioplasty, To ensure good results, patients should stay in the hospital for about 1 to 2 days and should not drive themselves home. Post-discharge care. Care for the wound with adhesive plaster until it dries. If the wound gets wet, clean it with antiseptic. Continue taking prescribed medication until the doctor advises stopping. Control risk factors for vascular health. Follow up appointments with the doctor as scheduled for symptom monitoring and physical examination. Consult the doctor if there are any concerns. Inform other doctors that you have had a stent placed. Payatai 2 Hospital, Heart Center, 12th floor, Building A. Call 02-617-2444, extension 4735 or 4736.